healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Good afternoon, everyone, and welcome to another episode. I'm your host, Stuart Newsom, and I'm thrilled as always to have all of you here with us today. This is a very exciting session that we're going to have today because it really addresses a lot of the critical aspects of healthcare operations that many of us grapple with every day, and that's prior authorizations. Prior authorization and the issues around prior authorizations have been a continuous problem that we've addressed, and we have had a lot of discussions. There's a lot of content on this subject. The last time we spoke about this, spoke about why do prior auths get denied even when you get them approved in the patient access portion or the intake side. So I encourage you again, go out, look, because it really is a fantastic story when you put it all together. And today, we're going to talk about standardizing prior authorization workflows. And we have Stephanie Cheng with us. She's actually our expert on the matter. She's our senior customer success manager is her current role. She brings just a whole lot of knowledge and experience in healthcare operations, particularly in streamlining and optimizing workflows. And she does this because she works hand in hand with a lot of our clients on a personal level. So how you doing, Stephanie?
Well, how are you?
Doing very good, doing very good. So I just want to pause for just a second. And if you would just briefly tell everyone kind of not more or less about your role, but just what do you do for our clients and helping them streamline not just the prior authorization processes, but just their processes in general.
Yeah, so just some celebrations here. I just celebrated my 3 years at Infinix. And of course, what I do here around standardizing, I do implementation. I help with the onboarding process. I help the businesses that sign on to our solutions use our solution to decrease the manual work and improve standardizations and efficiency.
Oh, that's awesome. Yeah. So I hope everyone's our ears are really perked up because I'm telling you, we do have someone with us today. Stephanie is definitely the one to talk to about all these issues. That's why we're very excited to get her as a guest on today. So our goal is to provide you with some practical, some actionable insights that you can implement in your own practices. It's not certainly not cookie cutter. I know everybody has their own processes they're dealing with, but we've done this before with many, many clients. So we have an understanding of exactly what works, what doesn't work, but then also be very agile to meet your custom needs. We're going to talk about diving into these complexities of prior authorization, is identify some of the common bottlenecks. We're going to discuss some strategies to standardize those workflows. And additionally, we're going to look at how technology plays such a crucial role in improving these processes. Stephanie, I just want to get started and ask you, can you describe some of the most common bottlenecks healthcare providers face in prior authorization processes?
Of course, here are some of the bottlenecks that I can think of that comes to mind in terms of healthcare providers facing in the prior authorization workflow. So one is lack of uniformity in processing the prior authorization requests. To know how to initiate the prior authorization, is it going to be through a web portal, phone, or fax? Like these are kind of muscle memories that the PAs really have, and I give them all props. And also tracking the prior authorization process as well. Of course, prior authorization could come in all different sizes where you're tracking it in the EMR system or a paper or sticky notes. It could be a stack paper that you just have on your desk. So tracking it to the finalized determination and having that crucial information documented somewhere safe for the backend to work is really important. And then two is the manual between systems. So there's a couple of systems you can already think of that you guys will use to manage prior authorization workflow. So like an EMR, EHR, practice management system as well could be scheduling tools and reaching out to the payer. So the management of multiple communication channels between providers, patients, and insurance companies often leads to error and further delays and overall increase the manual effort that takes away from the patient care.
Oh, that's awesome. So it sounds like to me, it sounds simple, but as we all know, as people go through these functions, it can be a lot of inconsistencies. Again, especially with the manual entry, but there's a lot of manual processes involved. And then you have different personnel probably across the line.
Yeah.
They all may do it a little different way, correct? So it's
Yeah.
imagine that that would increase the bottleneck as well.
Of course. Or if someone is out of office, right? And you're taking in place of someone that's out of office, you don't know where they left off. Tracking purposes is really crucial here.
And documentation is key because I know I'm a big documentation integrity kind of a freak because documentation matters. And it seems like everything you turn around, people really associate documentation with the clinical side of things that the
Mhm.
physician needs to, if it's not documented, it didn't happen. And if you're ever audited, you could have that money recouped, or might not get paid proof of medical necessity or whatever. But here, documentation definitely takes a huge twist where it matters internally for the team. So everyone understands that, like you said, if someone was out or if someone needed to kind of take over this case for whatever reason, that they understand where it is, what's its status, and what has been done so they can make decisions on what needs to be done to get that prior auth pushed through.
That's right.
How do these inefficiencies in prior authorization workflows impact overall operations and patient care? I know that sounds like an obvious answer to that question because it definitely will have a huge impact on them, right?
Of course, yeah. And two of the major impacts that comes to mind is one, delay of patient care, right? If we don't get prior authorization on time or we don't know where it actually sits, it delays the patient care. Is it increasing of peer-to-peer or denials as well? And overall, it can increase the efforts of the operation team that's working on the prior authorization workflow to get to the finalized determination.
Yeah, so that's just going to make, yeah. Now, again, that plays back to the bottlenecks as well. I mean, because these inefficiencies are a waste of time, which is money, could cause denials down the road, which is another waste of time because now you got to go back and research exactly what happened. Was it not prior authorization? What was kind of that root cause? So it all really ties together in essence. And then the number of human touches. I believe in efficiencies, and I always think if you touch anything more than once, then you're inefficient with it. So you can imagine if going throughout the entire process, the claim goes out, now it's denied, it really does affect the whole revenue cycle stream. And it affects the practice as a whole, even affects the patient as a whole and being in those inefficiencies.
Of course.
So what are some of the effective strategies that you've seen for consolidating and standardizing prior authorization processes across multiple locations and even practices? I've been waiting to get to this question because I know you've lived this, right? You've actually seen it and understand it better than anyone.
Of course. Yeah. So it really depends on your size of business as well. It does affect you in different ways. So, for example, if you're a smaller business, it does affect you in terms of different departments and consolidating the workflows within different departments. Of course, if you guys are a bigger client, an enterprise client, you guys will have different clinics, different locations. And with that being said, there's a lot of different, probably workflows that people use for different departments within that as well. So consolidating process C is a huge beast. And what I usually recommend is implementing a unified process for handling prior authorization workflows across departments that will help reduce some confusion in terms of where data lives. So someone can pick it up with where you left off, right? Minimizing errors so that you know where the data sits, so that the data that is sitting there it's what you can trust. It's the most updated version. That's where you're going to find it there. And then speed up decision making overall with patient care. And some of the things that we can consider is creating a standard template. I know from talking to one of my clients that you might have the capability of creating a standard template in your EMR system that has all the questions outlined and capturing the information, even though if the question doesn't really pertain to the procedure that you guys are talking about or the visits at that time, at least it gives a reminder to the doctor to ask those questions so you have that documentation there. That can also be tailored to different modalities where it could be, for example, like ortho has different modalities that's under that specialty as well. So like surgeries, imaging, injections. I know there's different criteria that you guys can document in your EMR system to help with the prior authorization workflow. Two is simplifying your workflow. So having another tool that can consolidate your prior authorization workflow where you're able to initiate, track your authorization workflow, and also have a documentation of where it lives and it has a single source of truth. So you can always go back to it and verify that information, or ever, if you ever need to look back on it, you have the capability of doing so. Three, I was thinking about integrating with your system with a tool that can help process your prior authorization. This reduces the data entry from one system to another system, decreases errors overall, increase efficiency with technology that can help track your updates.
Awesome. And that all sounds like a really good plan, but now kind of where the rubber meets the road, how like a real life experience involving what you've just stated. So can you share a case study or an example of a healthcare entity or a client that successfully standardized their prior authorization workflows? What were the key steps that they took?
Of course. Yeah, this is a simple one. And I'm sure there's many other case studies that we can talk about. Here's one where several clinics has merged into one umbrella group. So there's three different clinics, let's just say, and each clinic capture data differently. And we have some that are capturing from the paper documentations where doctors actually walk into the patient's room with a piece of paper. This is the procedure that we're ordering. These are the diagnosis code. These are the information that I'm capturing, and then they hand it off to a scheduler to schedule. So capturing data differently, and then so making information difficult to access from one place to another, or one person to hand off to another, and then workflows inefficiency. So by implementing like a training of some sort to help standardize where their data is going to live, where what workflow is going to be, so that we draw out, hey, this is the actual workflow that we want to abide to. This is how we're going to get every department to adopt it. Consolidating that workflow by producing like an SOP document, putting in where to put that information, making sure where to update that, so that everyone has a single source of truth in the system. And that will significantly improve the overall operation efficiency and increase coverage if someone was to be out, and pick up where they left off.
Oh, that's awesome. And I like how, we do have a lot of case studies of, we have many website. So I definitely encourage everyone to go out there and download some of those case studies because they're real live events based on how customers have implemented these processes and also combination of, I guess, tech and services in that mix, but also just what their roles were in that process and some of the behavioral changes they were able to institute. But it is an easy lift. It's, like you said, with training is very important for the staff and then have that change and be willing to that change, but it's change for the better, obviously. Now, and I mentioned kind of technology, and you did as well with the integration, but what role does technology play in streamlining prior authorization workflows? Are there any specific tools or softwares that you can recommend?
Yeah, it's hard to recommend just one, but here at
Right.
Infinite, of course, we have our prior authorization solution software called Patient Access. So in a traditional prior authorization workflow, of course, you're either calling and you're managing the data on the verbally, or if you're initiating the process on the web portal, you're managing the data from one system to another portal. So I would say invest in a specialized software that automates and track the statuses of each authorization request, where you have one tool that has the capability of initiating and then tracking the auth status, and then of course tracking your finalized determination, like I mentioned, where you can always go back to look for that data. And tools often can offer templates and standardizing form and reporting mechanisms that can help maintain consistency across all cases in that workflow.
Awesome. How about, I guess, all the buzz? It's just about everywhere you turn nowadays. And I
Mm.
even talked about it a little bit a few months ago after attending HIMSS. I was just at a conference local to my home, local HFMA, and it was a buzz there. It was all about AI, utilizing AI, machine learning, RPAs, and they were talking about it. It was really the CFO, CEOs, revenue cycle managers, patient access managers, and they're throwing these words around. I don't even think they understood what they were what they were trying to articulate because they weren't talking about it, but they were talking about how they were using it. But utilizing AI and machine learning, how big of a role do you see that taking in this process?
Since this is such a manual process, what we want to do is shrink down that manual efforts, right? That can increase the patient care and patient, caring for the patient that's right in front of you. So, in terms of utilizing AI and machine learning, I mean, some advanced system uses AI to predict the likelihood of authorization approvals based on the historical data. So the more data that's running through the system, the more predictability that we do have. This can help prioritize the workflow and allocate resourcing more effectively to make sure that we get those off that needs approval on its way.
Right, exactly. And then also one of the things that I've just thought of as well was the necessity of direct API integrations.
Mhm.
And when you're thinking about what just happened with cybersecurity, that's another big concern that's top of mind with a lot of leadership, a lot of organizations, especially what's happened with Change Healthcare and the recovery efforts for that, some of the lessons learned there, just the importance of API has been around for a long, long time, but it still has a lot of strength in speed and efficiency and having that. And a lot of people forget that. We're so wrapped around AI and machine learning, which you just well explained, but making that API connection can also assist too. That goes back to the integration with your EHR, your PM systems, your intake processes. If you can do that directly through APIs, and that definitely reduces the manual processes as well. I don't know if you had any more insight to what I just said.
Of course. Yeah. I mean, even just downloading a clinical documentation from your EMR system and uploading into the payer portal. If you're integrated with some type of technology through API, HL7, SFTP, anything like that, that is with the click of a button. So you get 5 minutes back in your hands.
And that's huge. 5 minutes is big, right? So one last question, and then we're going to turn it over to Q&A. But what are some of the common challenges healthcare providers might face when implementing these standard strategies and even some of the technology solutions? How can they overcome them? I mean, I think some people out there, they think of, oh, we're going to integrate a technology solution. They start to cringe because of some of the nightmares they may have had in the past.
Of course. I would say engage with your subject matter expertise in-house, your prior authorization leads within different departments and different specialties as well, including your clinical staff, because they do manage that clinical side of things, making sure doctors capture the notes. So engaging with your stakeholder, clinical staff, administrative personnel, and IT as well, because we want to automate some of this processes
Mhm.
to gather insights and suggestions to best approach the changes. Of course, we no one likes change these days, but change is going to improve our efficiency overall. And while you're carefully planning these changes, that can help with your long-term goals.
Awesome. So yeah, you got to collaborate. Seems like breaking down the silos and making sure you get all the stakeholders involved and collaborate on what's needed and plan it out. Now, is it going to go as planned? I think you know the answer to that. Probably not, but you have to be agile as well and be able to adjust to any things or shortcomings or hurdles that may develop. So that's excellent. So now I'm going to turn it over to Q&A. I do want to start off with the first question here, and it always has to do, this one is looking into the future. So they say, looking ahead, what trends do you see in the realm of prior authorization workflows and technology? And how should healthcare providers prepare for these changes?
Okay. So first off, we talk about a lot of integration, right? So automating your processes, finding a vendor, a solution that can help have a connection with some of these payers, third-party payers, so that when you're initiating these processes, at least you're following up and you're getting real-time statuses back in your hands. In terms of keeping trends of the authorization, approvals, denials, and things like that, I feel like those are all love languages particular to your business with your payer and how you guys are contracted. And that, with that being said, with using AI and machine learning and rolling through all the data that you do capture within your business, we can predict what is the likelihood of these CPT codes with this payer is going to need an off or does not need an off.
Right. That's awesome. So it really does help alleviate a problem that everyone's facing. Of course, the great resignation, there's a hangover from that. We still haven't really recovered from the workforce issues that we have out there.
Mhm.
So anytime you can have some processes in place to make that a little more efficient, it's makes it better. And I know that what we've talked about with automation and putting in RPAs, robotic processing automation, everyone's thinking that's going to be like the golden ticket or make it much better. But you just got to make sure that you're contracting with someone who knows what they're doing. They understand the workflows that you're trying to accomplish before they put it in there. I have heard some nightmares where oh, we want to automate our prior authorization process, or we want to automate, some of our correspondences back to the payers. And they build it and then they spend more time trying to correct what is built than they do. So it makes it even less efficient. So it's very important to vet who you're talking to. Do they have the expertise not only in healthcare, but in this particular mode of healthcare? So we have a few more questions here. Do you recommend a site to automate some of the services that never require prior authorization by payer? This is kind of a long question. So so do you recommend a site to automate some of the services that never require prior authorization by payer? Or is there too much risk at missing changes to prior authorization requirements? For example, we send all of our screening mammograms to our prior auth team to work before scheduling. The vast majority do not require authorization, and we see a lot of wasted time. But payers are always adding more requirements, not usually less.
Right. I can also speak on behalf of that. So,
Yeah.
a little bit about that process. Yes, I mean, you always want, if you have the resourcing power, you always want to check every prior authorization requirement, just because there's so many different insurances, so many different home plans. Well, you don't really know what the patient's actually enrolled in. So, like I mentioned, whenever you're initiating a prior authorization, it's that love language that you have in that particular patient at your site with that payer. So you really don't know what the outcome is. And it's best to always check for prior authorization when you can, if you have the resource and power. Of course, this is when you invest in tools like this where it can help you move data a lot quicker
Mhm.
from one place to another. Same with clinicals as well. I know sometimes, like radiology, it's really hard to get clinicals from the ordering physician because it's not on site. And if you can get them as quickly as possible to get to the payer, then you can move that authorization to the next step. I know sometimes there's always a time limit of some sort. So, with that being said, of course, it's always recommended that you check prior authorization for each patient and each procedure as they come in. And then with the technology that we do have, we can help make that workflow a little bit more efficient and quicker and faster and get you the result faster. And then AI and machine learning overall with capturing that data, of course, we can screen that out, like you mentioned, right? It does not require NAR, but with the increase of data transfer, you might as well check that to make sure that you are getting paid at the end of the day.
Right, right. And it was also helpful, and I think there's something that our platform does is just to predict whether or not a prior auth is needed or not. So that's a huge lift as well there. It's just, hey, we're just going to check if it is even needed. We're not going to apply for a prior auth and wait for the response. Am I correct there? I just want to make sure I'm correct there.
Yeah, there's a pre-screening.
Right, right, right. So it's almost like, do you even need it to begin with? And if the answer is no, then move on. You've saved time there instead of having to go through the entire prior auth process.
Right.
So here's another question. It says, you mentioned that clinical staff can focus more on patients and other work after patient access processes are improved. What does that look like?
I can give you a case study. So, one of my clients out in the Midwest area, they're a smaller little clinic. They do have their clinician who is seeing the patient create a prior authorization case right on their tablet. So, Infinex is accessible on the web. So, wherever you can access the web, you have access to Infinex. So, while they're finished with their patient, they're closing out their notes in the EMR system. They will put in their prior authorization requests right into the tablet. So, they set it and forget it. So, with that being said, that also eliminates you missing the prior authorization to be initiated if the data service is 3 months out or it might not be. And then two is they're multitasking, right? You don't need a PA specialist who's going to be managing that process. You just have your clinical staff, roll right into the next task and then set it and forget it, and it's already completed.
Awesome. So another question is more payers are popping up every year. and most are out of network as they're not contracted. Yeah, yep. Many are requiring prior authorization for all services. How do we get ahead of these without contracting with every single new payer that comes to our area?
One.
That is a good one. I will say, I just read an article this morning. This is funny how questions come up, and that's something I just read this morning. Well, and it kind of ties to it, but I know, like in the state of Vermont, the governor just signed into law regarding, it really had to do with Medicare and Medicaid, but it will spill over to other payers as well, about cutting down some of the ridiculous prior authorization requirements that they have, particularly if it has to do with testing, just rudimentary things, screenings, and it makes it illegal now, at least in that state. And they think it's going to spill over to New York and some other places in the New England area as well. So that was really encouraging to see that legislation, because you know what happens when one state does something, pretty soon some others will follow, and then pretty soon it's the majority of the country. So I think the states, if you just go to your legislature and encourage them at the state level that this is an issue, obviously the burden on the provider, but also the burden on the patient. That's what's really going to make the needle move on that. And I think just being that advocate for and doing that, and the legislation will listen. I think the Vermont bill passed however many congressmen they have to nothing. I think it was 137 or something to nothing, which is very rare, right? Zero nays. So it's encouraging to see that. I think everyone's on the same page when it comes to this, especially when you mention how it affects patient care. All right. Well, with that, we are going to conclude this episode. Really, again, appreciate everyone joining. Stephanie, I really appreciate you joining us. It was awesome. You'll be on again. So it's not a one-time thing.
Yeah.
We'll be looking forward to have you join us again in the future. Until next time, everyone be safe and have a fantastic day.
Have a good one, guys.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.